There was one other question I just wanted to drop in if you've got a minute to share an answer, which is just around a trial of eltrombopag in children, if you had any comments on that.
So I'll talk a little, I mean, you'll probably hear it more from Austin, but the adults study has, as you know, shut. So that was a randomized study looking at eltrombopag plus or minus ATG and cyclosporine. So what they did is half the patients got horse ATG and cyclosporine, the other half got ATG, cyclosporine and eltrombopag. The inclusion criteria was over 16, and I've seen the provisional data that hasn't been published. The provisional data showed that if you got eltrombopag on top of ATG and cyclosporine, the response rate was 75% versus a response rate with the ATG and cyclosporine of 50%. Now, that has to be published and has to go what we call undergo a peer review process. But hopefully in the next few months that will be published. So what that, and there wasn't any increase in clonal evolution with the eltrombopag. So in terms of, we were worried that the eltrombopag might stimulate the bone marrow and cause some abnormal genetic changes, but that hadn't been the case on the study. Now, the study was only up to, I think, 2 years, so it's very limited follow-up, but it did show, as I said, that big benefit for eltrombopag. So I think once that study is published, that will become, I would assume, standard of care for immune suppression. So using horse AG, cyclosporine, and eltrombopag. In children, there's a dose-finding study. Manchester's open. Birmingham, I think, is also opening or open, and we've recruited 4 children for all sorts of reasons. We probably won't recruit anymore because we have targets and we were supposed to recruit 1 and now we've recruited 4. So that's the only study that's available worldwide for eltrombopag. If your child is due immune suppression, you could always ask your clinician to try and get it potentially funded. So some clinicians have managed to get what's called an IFR, which is individual funding requests, where essentially the hospital at the NHS somehow pays for it out of their own budget. I would suggest that I think if you're giving immune suppression, you try and give it with eltrombopag, including to children at this moment in time. And that's what we're doing, if we can, at GOS as well. Try and give eltrombopag to any child who comes in with aplastic anemia, if we can. As I said, it's not available, though, freely on the NHS. You either have to get your hospital funded or go into a clinical trial.